Bado tuko pamoja. Can you react if you can hear me? Blair was asking something, if I'm not wrong. Did you guys hear him? Benjamin?
No, Blair was not asking question. I think I was adding up something. I was just adding up something that currently I was relating people that how health information system is important. Like considering that what has been happening in Nairobi, the KCC, when they have been having the health convention there, only the health
Mm,
system has enabled the president to know how many people have benefited from SHA, how many people have done surgeries, how many hospitals have this. It is through the health information system that enables the government to be able to monitor the progress of the healthcare system that is under use. That is, I was making an addition, I think, when your network started gambling around.
thank you. Thank you so much. I was asking you guys if you know any types of health information. If you are asked, identify maybe various types of health information.
EMR. Sijui inaitwanga electronic medical records.
That's a system.
Yes.
I'm asking like health information. These are things like patient information, demographic information, mortality information, financial information. Ya vitu kaa hizo. So mtu akikuuliza types of health information, yeah, you be like maybe health service information, which has a service being provided. Mortality information, this is the data on deaths, causes, and their rates. Vitu kaa hizo. Hii ni Cherop nasema, so hiyo ni nini? Because there's this other question 2, state 5 reporting forms used in health information system and their function. State 5 reporting forms used in health information system and their functions. During your research, what did you find? Did someone find, yeah, like what did you guys find? Because me, I found those registers. Yeah, those ones.
Same.
Same.
Yeah.
What about the Cherop was saying the EMR? It was also a tool in health information. What is it?
I think it will fall under types of health information system.
System.
Yeah, I think so. I'm not sure.
Okay, let's finish up question 2. So the purpose of reporting forms, they provide standardized way of collecting, summarizing, and reporting health data from service delivery levels to higher levels, probably for planning, for evaluation, and for decision making. So hizi forms zenye zinauliza inasema they are standardized in a way that collecting, summarizing, and reporting data inakuwa easier. So you saw those forms, there is a way you record patient information, then hapa chini you summarize. So the forms I found, MOH 204, this is the outpatient morbidity summary. It reports diseases and conditions diagnosed among outpatients. Yeah. The other one is MOH 205. That's the inpatient morbidity and mortality summary. Reports the inpatient diagnosis, admissions, and deaths if they're there. Then we have MOH 240. It's the lab reporting form, which reports the lab results, the lab tests, and the lab results. That's MOH 240. Then we have MOH 711. MOH 711 is the health facility monthly summary. It summarizes the health facility services and activities for monthly reporting. Then we have the MOH 705, which is the community health service report. It reports the services and the activities which are provided at community levels. Then another one is MOH 731, which is the immunization report or the expanded program of immunization report, which reports the immunization services, the doses, and the coverage. Yeah, I've given you 1, 2, 3, 4, 5, 6. I've given you 6 forms, the 6 registers. Does someone have additional ones? Kuna mtu anaongeza ama kuna mtu hajasikia? So we are
I'm requesting utume kwa group.
oh, sawa, I will.
Thank you.
Then question 3, state and explain the building blocks for World Health Organization health system framework. The building blocks. Do we know the 6 building blocks? The building blocks are 6. First of all, what's a health system? Who knows how to define a health system? Because if we can define a health system, then we'll know the function of health system, which has the 6 building blocks. So a health system is the organization, like, okay, let me read it in 2 forms. So it consists of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. So that's how you can define health system. Or you can say it's a structured and interrelated work of all agencies contributing to health within a country, and include efforts to influence determinants of health as well as more direct health improving activities. So it's we can just say it consists of everyone, every resource, every action whose primary intention is to promote and maintain health. So now the 6 building blocks you guys are going to tell me because you're so quiet. The 6 building blocks of health.
Health workforce.
Health workforce. Health workforce is the same as human resource for health. So, it's health workforce or health or human resource for health. Human resource for health. So, a well-performing health workforce is one that works in ways that are responsive, fair, and efficient to achieve the best health outcomes possible, given available resources and circumstances. So for a good health system, or let me call it a good health system, we should have sufficient staff, fairly distributed, they should be competent, they should be responsive and productive. So of the 6 building blocks, number 1 we have human resource for health, in brackets unaweka health workforce. So somebody to tell us the second one.
Service delivery.
Yes, service delivery is a building block. So good health services, they're the ones that deliver effective, safe, quality personal and non-personal health intervention to those that need them. So a good health service delivery should ensure quality services is delivered or are delivered with minimum waste of resources. So our second building block is service delivery. Service delivery. It should be effective, it should be safe, and it should be of high quality. So building block number 3 is telling us that the third building block. Nani? So we have health financing. Health financing is a building block. It's a health system building block. So a good health financing system should raise adequate funds for health in ways that will ensure that people that use or that need services, they are protected from financial hardships, and also provide incentives for providers and users to be efficient. So a good health financing system should provide financial protection to those who need care. So we've said building block number 3 is health financing. Let's go to 4. Building block number 4. Do you have someone telling us? Email, who is talking?
Health information system. Naona Newton ametype pia.
Yeah, health information system is a health system building block. So a well-functioning health information system is one that ensures production, analysis, dissemination, and use of reliable and timely information on health determinants, health system performance, and health status. So a well-functioning health information system should provide information that is reliable, and timely. So yeah, so health information system is a building block. It's a building block. Number five, we have leadership and governance. Leadership and governance is our fifth health system building block. Leadership and governance. So a good leadership, a good governance should ensure strategic policy frameworks, attention to accountability, effective oversight. Yeah, yes. So leadership and governance is our fifth building block. Number six, who's going to tell us the last building block?
Access to essential medicine, vaccine, and technologies.
Thank you so much. So medical products, vaccines, and technologies is our sixth building block. So a well-functioning health system should ensure that there is access to essential medical products, vaccines, and technologies, and they should be of assured quality, they should be safe, they should be cost-effective, and scientifically sound. So access to medical products, vaccines, and technologies is our sixth building block. Tuko pamoja? So what you should know is we have 6 building blocks, and you should be conversant with all of them. Okay, maybe even if you want to revise HSM, you can really look into each building block on its own. For example, the first one tulisema ni human resource for health or health workforce. Huko you can read on human resource management. Yeah. Then on service delivery. Service delivery is a topic on its own. Health financing also is a topic on its own. Leadership and management, ziko hapo pia, it has its own notes. Health information system also is a topic on its own. So someone can go and look into these building blocks separately. And our question was asking, state and explain the building blocks for World Health Organization health system framework. We've mentioned all of them. Unless someone is not understanding or has not understood any building block, then we can answer. Kuna mtu amebaki nyuma? We are okay? Okay, then we can proceed to question number 4. State and define the principles of healthcare delivery. Principles of healthcare delivery. You've even seen, like, our first question on health system on health information system, and you've said health information system is a building block. Our fourth question is asking on healthcare delivery. Healthcare delivery is also a building block because we talked about service delivery as a building block. So the question is state and define the principles of healthcare delivery. This one will save faster. Very faster. Everyone can even mention one. The principles of health care delivery. For me, I can say it should be of good quality. It should be of good quality. What do you mean by good quality? It should be safe. It should be effective. It should be timely. And should be patient-centered. That's the first principle. So let's mention others that you know. Imela, do you know any?
Yeah, I'll go with it should be safe, or it should provide safety, whereby it should ensure that it does not cause avoidable harm or injury to the patients, the health workers, or the community at large.
Yeah, thank you so much. That's so well explained. It should be safe. That to mean it should not cause any harm, either to the patient, to the healthcare provider, or the environment. Benjamin. Okay, it should be accessible. Accessibility. It should be accessible both physically and financially. It should be within like a geographical reach, like, yeah, should be accessible physically, and also it should be accessible financially. And that's for accessibility. It should be accessible. Oscar, unmute and explain your point. Oscar said, is it equity or equality? I'll go with equity. Equity means resources or services should be distributed fairly according to needs. The difference between equity and equality. Equity is we are giving it fairly but according to needs. Then equality is just fairly. Fairly is giving everyone same amount, but equity is basing it on need. Oscar, umeelewa ama someone else should explain? Umeget? Nimeona Manzungu, you wrote something on financial protection. Can you explain? Also, we have community participation as a principle. This means that the community should participate in identifying their health problems, planning and implementing solutions. So community participation is a building block. It's a principle. It's a principle, sorry. It's a principle. Community participation. The community should participate in identifying their needs. Principles of health care delivery. Principles of health care delivery. Benjamin. Principles of health care delivery. Cherop amesema effectiveness. Sharaf, can you explain?
I hope mtanikubalia ni explain basi kwa Kiswahili.
Okay.
So I'll use an example. If a patient comes in and expected to be treated for, let's say, malaria, effectiveness inamaanisha that the patient will come in, be treated effectively for that exact symptom na akwe treated vizuri. That is effective. But don't talk about mtanielewa.
Okay. Effectiveness. What of efficiency? Effectiveness. Effectiveness is almost the same as quality. It's almost the same as safety. It's almost the same as patient-centered. Umepata? But you can explain it differently. But effectiveness, quality, safety, and patient-centered are almost the same thing. We also have efficiency. Efficiency is different because efficiency ensures that available resources are used appropriately to achieve maximum health benefits. Efficiency is like using minimum resources to achieve maximum results. So, another principle is continuity of care. Patients should receive care throughout their illness and across different levels of care. Another one is acceptability. The healthcare delivery should be acceptable. It should respect people's culture. It should respect their beliefs and their values. Another one is affordability or financial risk protection. It should be affordable without causing any financial hardship. So, yeah, easy to like this one you can just apply. I don't think if it has fixed answers. You can apply according to how you understand the question, but just remember equity, remember affordability, remember good quality, remember community participation, remember acceptability, remember continuity of care, accountability. Yeah, you should remember those ones. Let's go to question 5. That's so simple. I'll expect somebody to say mwingine aseme, then we move because time is really moving. Question 5 is state and define any leadership styles. State and define any leadership styles. Leadership styles, it simply means ways a leader directs or interacts with people to achieve the goals. Ni vile tu sasa a leader leads. Is this a way? Yeah, that's a leadership style. We discussed this last time. So let me see, those who have not talked today to tell us the leadership styles. Unasema na una explain in simple terms, very simple words yenye tunaelewa mbio mbio. Edwin Okinyi, tell us one leadership style. Then Oscar. Then Julene. Kama nimekusema na unaona mwingine aseme, you can unmute and tell us. Edwin, are you there? Julian.
Okay, democratic leadership. This is a type of leadership in which a leader involves their juniors in making decisions. Yeah, iko sawa. Like leader and involve their juniors in making decisions and carrying out of activities. Like it is not centered on him alone. Yeah.
Thank you so much. That's the simplest definition that we expected. Democratic participation, like it's democratic or participative. This where the leader involves team members in decision making and carrying out activities. Hivyo tu, hatutaki story mob.
The little or not from the subordinates. Yeah.
Thank you so much. You've really explained it very well. Autocratic. The leader makes decisions alone. There's little or no consultation with other members or other staff. So, yeah, that's the simplest way we can understand autocratic. That tumesema Millicent, tell us another one. Lily. Millicent, are you there? Okay. Nancy.
We
Newton.
have transactional leadership.
Okay, we have.
In this case kuna kwanga na rewards and punishment. Rewards for good deeds and punishment for
Rewards on a good performance. This punishment or corrective measures on poor or bad situational. We've mentioned 4. Manzungu has faith. Tuambie wanaisoma aje and what it means. Benjamin,
Oh, I just typed
you also
wrong.
have situational.
It is laissez-faire.
Yeah. So
Laissez-faire, where
like
it is the hands of the leader gives the team members or the workers the autonomy to perform work, and he can work with those who are the skilled team, but also allows the other part also to contribute. So that's what it is fair. When you hear the word fair, there is some fairness. Yes, it involves working with those who are more skilled in the team, but there is involvement of the others by giving them, or what we call, autonomy, the ability to make their own decisions. Back to you.
yeah. Thank you so much. This where the leader gives employees the considerable freedom to make decisions. Yeah, we also have situational leadership. This where the leader changes their approach depending on the situation, or depending on the task, or depending on the competence of the team. Yeah, this is called situational. Situation. Anabadilisha approach of leading depending on the situation or the competence of the staff. Yeah, we are done with types of leadership unless we have left out a point. Kuna important point hatujasema kweli? Hakuna. So Anders to do the last question because it's already 9. There's that question on let me read. Explain the progressive disciplining of an employee.